So this left image is the coronal graphic, which seems to be depicting the findings in severe traumatic brain injury. This is a closed head trauma case, and it has resulted in multiple gyral contusions and subarachnoid hemorrhage. Most traumatic subarachnoid hemorrhages they occur adjacent to the parenchymal brain injuries, and they are found centered around the sylvian fissures, the inferior frontotemporal, and the convexity sulci. Right image is the axial non-enhanced CT scan in a patient with head trauma, and the traumatic subarachnoid hemorrhage shows the focal hyperdense collections in a few left posterior frontal sulci bordering the interhemispheric fissure. Left is the axial non-enhanced CT scan in a 28-year-old man with closed head injury, and it shows the traumatic subarachnoid hemorrhage in the right sylvian fissure. Also noted is the absence of blood in the adjacent suprasellar cistern, which is a more common site for aneurysmal subarachnoid hemorrhage. A left parietal epidural hematoma is also present. Traumatic subarachnoid hemorrhage often occurs in combination with other injuries. The right image is the axial non-enhanced CT scan in the same patient, and it shows the typical curvilinear configuration of the traumatic subarachnoid hemorrhage in the sulci of the right temporal lobe. Left is the axial non-enhanced CT scan, and it shows the hyperdense traumatic subarachnoid hemorrhage within the sulci, left sylvian fissure, and the ambient cisterns, and the interhemispheric fissure. Right is the non-enhanced axial CT scan, and it reveals a small collection of hyperdensity along a left frontal medial sulcus, which is representing the traumatic subarachnoid hemorrhage. So left is the axial non-enhanced CT scan, which demonstrates the collections of hyperdensity within a few sulci and the interpeduncular cistern from the traumatic subarachnoid hemorrhage. Axial FLAIR MRI shows the abnormal CSF hyperintensity within the interpeduncular cistern and the ambient and quadrigeminal cisterns. It also reveals a small amount of layering dependent hemorrhage within the right occipital horn. Left is the axial FLAIR MRI. It demonstrates the traumatic subarachnoid hemorrhage as an abnormal CSF hyperintensity within the right sylvian fissure, as well as within a few right sulci. Axial non-enhanced CT scan shows widening of the right image is the axial non-enhanced CT scan, and it shows the widening of the bilateral sulci, right more than left by a CSF isodense process due to the subacute to chronic subarachnoid hemorrhage. Left is the coronal graphic, and it demonstrates the pathology of closed head injury. Noted is the hemorrhagic foci involving the gray matter of several contused gyri, axonal and deep gray injuries, and traumatic subarachnoid hemorrhage in the basal cisterns and sylvian fissure. Right is the graphic depicting the most common sites of cerebral contusions in red. Less common sites are shown in green, and the most common locations of all are the inferior, frontal, and temporal lobes. Left is the gross pathology of the brain from a patient who died from severe closed head injury, and it shows the bifrontal temporal hemorrhagic contusions as well as the traumatic subarachnoid hemorrhage in the suprasellar cistern. Right image is the non-enhanced CT scan, and it shows the extensive frontotemporal contusions and the traumatic subarachnoid hemorrhage in a patient with severe brain injury. So continuing with the cases of cerebral contusions, left is the initial axial non-enhanced CT scan in a 24-year-old man with severe closed head injury and a GCS of 8 on admission. And it shows only a focal contusion in the left inferior frontal lobe and a small amount of subarachnoid hemorrhage in the inferior interhemispheric fissure. Right image is actually the repeat CT scan, non-enhanced CT scan, 6 hours later, and it shows the interval appearance of cortical contusions along the surface of the right temporal lobe. Cortical contusions commonly bloom, that is, they become more conspicuous on the follow-up imaging studies. Left is the axial non-enhanced CT scan, and it reveals a hemorrhagic contusion of the right cerebellar hemisphere. This contusion has coalesced into a focal hematoma. Right image is the non-enhanced CT scan 24 hours after the head trauma, and it shows the frontotemporal contusions and the left inferior frontal subdural hygroma. Left is the T2 weighted MRI in the same patient obtained immediately after the CT scan, and it shows contusions with perilesional edema and small bilateral subdural hygromas. Right image is actually the T2 star grease sequence in the same patient, and it shows the blooming. It shows blooming of the right frontotemporal contusions, and the left temporal contusion is also apparent that was not evident on the T2 weighted MRI. So, diffuse axonal injury cases. Left is a sagittal graphic which is illustrating the multiple diffuse axonal injury hemorrhagic foci within the corpus callosum and the brain stem. Right is again a graphic image, and it depicts the most common sites of axonal injury in red. Frequent but relatively less common locations are shown in green, and injury to the midbrain or upper pons is uncommon, but it is often lethal. In general, the deeper the abnormalities are, the more severe the injury is. Left is the axial non-enhanced CT scan in a 25-year-old man involved in a high-impact motor vehicle accident, and it shows multiple hemorrhagic foci in the subcortical white matter, external and internal capsules, basal ganglia, and thalami. Blood is also noted in the right, in the third and lateral ventricles. In the third and lateral ventricles. Right image is the more cephalid non-enhanced CT scan in the same patient, and it shows the punctate peripheral hemorrhages in the subcortical white matter. Traumatic subarachnoid hemorrhage is also present. Left is the axial non-enhanced CT scan in a 26-year-old woman involved in a high-impact motor vehicle accident, and it shows only a small linear hemorrhage in the corpus callosum. GCS was 6 at the accident scene. Right image shows that because of the discrepancy between the lack of findings on the non-enhanced CT scan and the low GCS, MRI was obtained. And this is the FLAIR scan sequence, and it shows the hyperintensity in the corpus callosum and the subcortical white matter. Left image is the T2 star GRE sequence in the same patient, and it shows multiple punctate and linear blooming hypointense foci in the subcortical and deep white matter and corpus callosum. Right is the axial SWI sequence with MIP images, and it shows the innumerable punctate and linear hypointense foci that follow the course of the axons within the corona radiata. Left is the axial DWI in the same patient, and it is showing the intense restriction in the frontal white matter as well as throughout the corpus callosum, both fornices and subcortical white matter. Right is the midline sagittal DWI in the same patient, and it shows the intense restricted diffusion throughout the corpus callosum. A smaller focus of restricted diffusion is also present in the midbrain.